Please go ahead.
Thank you so much. Good afternoon, everyone, and thank you to everyone who's joining us today on Zoom. I'm Monique Taylor, the MPP for Hamilton Mountain and the official opposition critic for mental health and addiction. With me today are Tammy Reed, a long-term care worker from Hamilton, and Josie Barberi, a grocery store worker from Toronto. They will be sharing their stories with us in a few moments. Today, I will be introducing my private member's bill that would provide presumptive WSIB coverage for mental health benefits for workers that continued to work in person during the pandemic. That's any worker who was deemed essential or who worked in a workplace deemed essential by the government's emergency orders. Right now, workers have to prove to WSIB that their mental health issues came from work, and WSIB could fight them on it. This bill would stop that from happening for these pandemic workers. Throughout the province, we've seen a catastrophe unfold in our long-term care homes. In my riding of Hamilton Mountain, Grace Villa's nursing home had a horrible outbreak that affected over 230 people and killed over 40 people. The workers in that home told me it was like a war zone. These workers were the first reason why I introduced this bill. It was truly heartbreaking to hear their stories from families and staff who went unsupported and had to watch the residents they care for suffer and die. Just recently, the Ontario Nurses Association did a survey of nurses and found that 60% of nurses working in long-term care during the first wave have had symptoms of post-traumatic stress disorder. In healthcare, the mental health burden of working through this time has been well publicized. But we need to remember that there are so many other sectors where workers have been impacted: grocery, retail, pharmacy, childcare, education, food processing, and restaurants. In all of these sectors, and many others, new demands were placed on workers. Think of the grocery or the retail setting, where people refuse to wear a mask, where they become agitated, or where staff don't have access to adequate PPE and are in constant fear. Lots of workers even caught COVID at work and were unsupported by their employer. If these workers in these settings start showing symptoms of PTSD, anxiety, or depression, what benefits can they access? What help is there for them? That's why it's important to make this bill as broad as possible to include as many workers as possible. Essential workers continued to work so that we could stay at home and stay safe. They were, and they continue to be, in harm's way. The least we can do is ensure that they are taken care of. This bill, if passed, would ensure that workers can access mental health benefits and services if they need it. I will now pass it over to Tammy to share her experiences of the past year. Go ahead, Tammy.
Thank you for having me. So I hope I can bring light to the mental health aspect of all frontline workers. I was asked very last minute to step in for a fellow coworker. So from where we started to now is very different. You know, you go in and you sit back and you watch other homes be absolutely decimated, and your heart breaks, and you're strong, and you think it's not going to happen here, and we're a team, and you're moving along, and then all of a sudden it happens to you, and it happens quickly, and the ball goes very quickly. You now have, you know, it's just like a domino effect. You start with one, and then within a couple of days you have 5, and within a week you have 10 and 15, and now you have all these sick, very sick people, and no families can come in, and nobody can come up to help you, basically to protect and keep it from spreading. What you have is what you have, and you make the best of it. So anybody that works long-term care or knows staffing has always been an issue, even before COVID. So now you add COVID, where people have had to choose between 2 jobs, and you add the fact that they too are falling sick. So one by one, we watched these people that we have cared for and loved as our own, that have become our second family. You know, there's this belief that they've come there to die, and that's absolutely not true. This is their home. They make friends, they garden, they do lots of things. And our families, we take them in and and visit, and they become our family. So here we are watching these people fall sick, and there's nothing we can do. And it was heartbreaking, absolutely heartbreaking. Once we had our first death, it was like just a runaway train, because there wasn't a day after that, from the first death till the end, where we didn't suffer a death of our loved ones. And you can, it's how they died. When somebody passes away, yes, we're used to it. We do what we do, and then the funeral home comes and they take over and they do what they're trained to do. It's not our scope, but that very quickly became part of our scope. Whether you were recreation staff or you were PSW, it was all hands on deck. And there was nobody allowed in, so there would be a cart, and we would have to prepare our residents' bodies to go out, and it wasn't done. This was COVID, so they had to be wrapped up in plastic bags, and it was very hard for us as staff to, if we hadn't rallied. There's a lot of things that go down in large facilities, but we really rallied. We really supported each other, and if we hadn't have, I remember one day. There was only one day in all that time that we didn't have a death. One day. And we thought, my God, maybe there's hope. Maybe we're coming to the end of this. Only to absolutely be crushed the next day, because we had 4 deaths back to back and very little staff at that point. I don't know don't quote me. I think by the end there was 89 staff sick. So we were down to very little at that point. Myself and a recreation staff, actually, while the nurse was dealing with doctors and funeral homes and these poor families, we actually went from one resident to another resident. We broke that day as a team. I think we all hung our heads and we just cried, because there was a sense of hopelessness, just helpless. We cannot help these people. We want to. There's not one person that went in that facility without the intent to be there for those residents. There isn't enough money in the world that would make you want to put your family at risk. There was families that, they sent their kids away. They stayed in hotels. Some didn't have those options. Some did take it home to their children, their weak parents that were staying with them. And then we were watching our own staff drop, 89, some of them in hospital, in ICU, on oxygen, and scared for them, scared for ourselves, and just not being able to do anything to help these people that we absolutely loved. And we took it very seriously that these families put their trust and their faith in us. We took that very, very seriously. I myself had a family member in the facility, and it's devastating, because you are all to them now. They don't have their family. You want to be with them and you want to do so much for them, but COVID, it left us helpless, and we just didn't have the means to help these people. It's surreal looking back. I don't think even any words that I say could possibly explain what we went through in that time. So it literally was all hands on deck, and we now have staff that fell sick and have tried to go back and have fallen flat on their face. They can't do it. They've walked in the anxiety, the panic, the fear, and how can I go off? How will I pay my bills? I can't, if I file for unemployment, I'll only get this amount, and then I have to wait. And so you have people really struggling with how to get help. And there's fear and there's shame, and your coworkers looking at you saying, well, why can't you just move forward? Because some people, they're okay, but there's some who are not. And it's okay that some of us are not okay. And it's okay, we need help. And that help should be available, not before we hit a brick wall, but to say, I need help, get that help, and then get you back to the job that you love to do. So.
Exactly. Thank you so much, Tammy, for sharing your story and for joining us here today. Josie, how can you share your experience with us, please?
Yeah, absolutely. So as Monique said, I'm a grocery store worker, and, let me start at the beginning of it all. If you all remember, at the beginning, there was pure chaos and people were panic buying and hoarding and all this stuff. And we had to deal with so much. We had these belligerent customers just being really chaotic inside our stores. It was very unsafe, very high stress, and so traumatic. Our employer was doing barely anything to keep us safe. We had no PPE available to us. There was no social distancing. There was like no crowd limits and things like that at the start of the pandemic. And then you had people that were starting to get sick, and they weren't really communicating anything to us. So, you know, you have to think like how stressful this is. You have the stress of like the virus and you potentially getting sick. You also have the stress of these volatile customers who are assaulting us. And plus on top of that, you have the stress of like being overworked, because we were all working overtime hours just to keep up with the demand of the sales, because when everything was starting to shut down, we were the only ones who were open. And the thing that kind of made it like kind of added insult to injury in the beginning of this is that, you know, they kept calling us heroes. And that phrase started to become really triggering to us because we didn't feel like heroes. We were feeling like sacrificial lambs. And we didn't have a choice but to be there. And there were so many people who were having anxiety and didn't want to be there. And the employer's like, oh, that's not a reason to not be at work. And it's like, how is that not a reason to not be at work? Our physical well-being and our mental health were not being taken into consideration at all, while my employer was making record-breaking profits. And then I got sick, and, you know, I'm very lucky because I know my rights, and I work in a unionized grocery store, and my union supported me so much. They helped me so much with this. They told me to file WSIB. My WSIB union reps helped me. All the staff there helped me. They totally supported me with all of that and morally. And I feel so lucky to even have a union, because I can't even imagine what someone else in another retail sector would have went through if they didn't have a union. And so I got COVID really, really bad. And I even ended up in the hospital at one point, and I was off for 5 months in total. WSIB ended up paying only 3 months of that. And it was 3 months because that's how long it took for me to get my second test, because I was really sick and I wasn't able to go get a test until I was well enough to go without all the symptoms. So the minute I got my negative COVID test, WSIB cut me off and we're not paying anything. And we're like, you can go back to work, even though my doctor gave them a report and said that I'm still not well. And on top of the symptoms that I was still experiencing with COVID, there was other things I was dealing with so much anxiety and PTSD, things that were directly related to going back to work and the experience that I had. During this time, while I was off, I was also seeing a therapist to deal with all of that. I was having panic attacks and anxiety, lots of PTSD symptoms. I was having depression and severe insomnia and all these other things that were directly related to pandemic stress and the trauma that I experienced, our working conditions, plus being sick with COVID and having a COVID outbreak at our location. We had an outbreak on our location and they weren't communicating anything. There was, I think at the end of it, there was probably like over 30 people of us like that. I got sick at my location. We had people and we had someone in the ICU, plus at our other locations. We were hearing about people, so many numbers going high with getting sick. We've had a couple of deaths as well. So it was like very stressful. And I stayed off work 2 more months after WSIB cut me off. And the only reason I even returned to work is because I felt like I had no choice, and no, they weren't compensating me anymore. I couldn't afford to be off work. And, you know, as you mentioned about the unemployment, Tammy, and the support, you know, you weren't going to get as much. And plus then you have to pay like all this interest afterwards. So all these things were just kind of like, okay, I'm going to have to go back. I don't have a choice. I felt forced to go back to work. And that was giving me so much stress and anxiety, having to like deal with the customers still there's still people, even now, because there's COVID fatigue, there's people who are very aggressive still in our stores. Having to work in that environment still, the fear of getting sick again, and also having to deal with our unrealistic employers' demands at work. All of that is just like impacting the already like state of anxiety and PTSD that I have from the first traumatic experience. So our mental health has like suffered greatly as a result of this pandemic. And this is definitely something that should be taken seriously. And our mental health it doesn't just affect our moods and stuff. This could affect you physically as well. And it's been shown that our mental health issues can manifest into physical symptoms as well. And so there has to be some kind of support and care and compensation for those of us who are suffering mental health stress injuries in workplaces, because how can we continue and do our job safely? And at this point, it just feels like there's no care or concern for the people in the front lines, whether it's us in the retail sector or even healthcare workers. It just feels like we're the bottom line, and so many of us are suffering from that mental health exhaustion, from anxiety, depression, because of the stress that we have to deal with, and especially all of the stress we dealt with from the beginning. And I just think it's something that we're witnessing across the board for all of us frontline workers, and the impact on us has been really huge and devastating, and it's something that absolutely needs to be addressed and that we could no longer ignore.
Thank you. Thank you so much. Thank you both for giving us this time today. I believe we're going to go to the press if they have any questions.
Thank you, Monique. Thank you also to the journalists who have joined us today. Just a reminder to use the raise hand button if you would like to ask a question. And I'll just give you a few moments to do that. The first question on the line is from Maria Iqbal at the Hamilton Spectator. I will put you through now.
You're on mute, Maria. There you are.
Hi, hi, thank you.
Hi, Maria.
Thanks. Thank you both so much for sharing your experiences. My questions are for Tammy. I'm wondering if you can speak to exactly what kind of mental health supports you and your colleagues may have had access to at the time, and what kinds of supports you think would be enough for, I guess, for lack of a better word, like for the awful things that you've seen and experienced.
At the time when we were going through it, there was no help. When it got very bad at the end, I had actually reached out to our in-house social worker, who by then had permission to come up to the floor, and she had put together a package of numbers that you could call. There was certain social workers and psychiatrists that were donating their time to speak to people that had been affected by it. So we were given a piece of paper. Now once I reached out to my own doctor for help after trying to return and not being able to, even looking into getting help. Yes, we have it through our Green Shield, but it's only a certain amount of time. So you would get maybe two sessions. So you're going to go in and you're going to open yourself up and you're going to share this absolutely traumatic experience that you haven't even had the time to process. Like really, truly, you don't get to process it. You're living it, then you're sick, then you're back and you're, what is going on? So there's really no support for us in place. As far as money, I've been off 2 months. I went back and I've been off 2 months, and I received my first check last Thursday for unemployment. And I'm still currently waiting for WSIB to help me. And if they do, then maybe I can get some help. I have a diagnosis. I am dealing with PTSD. Numerous of my staff are, and I'm hoping that my coworkers will come forward. They're struggling, and I hope that we can get them the help because ultimately we need to be healthy to go in and look after these people. So.
Thank you so much. And if I may, can I have a follow-up question as well?
Of course, please go ahead.
Thank you. Tammy, I wonder if you can give us an idea about around how many staff have not been able to return to work?
I'm not really aware of those numbers, to be honest. I'm not aware of who's come back and left in that time. I just know that there is, because I've reached out. Once I said I was struggling, I've had people reach out to me that have said they're struggling and they're not there. So those are private things. I'm not really sure the numbers of truly who's gone and left and not returned at all. So.
Okay, thank you.
If you have a further question, that's okay, Maria.
Sure, thank you. I guess I would just ask, like, how are you doing now?
Are you asking me or Josie? Me?
Yes, for you.
Honestly, a week ago, I would not have been able to sit down and have this conversation. I would not have been able to discuss it. I just want to point out that we're all different. We all experience things. We could all read the same book, watch the same movie, and take completely different things away from it. I've always considered myself a very strong person, and this has really brought me to my knees. I don't sleep at night. And I think that there was so much embarrassment to say you're struggling because you're looking at your coworkers and they seem to be doing okay, but you'd be surprised at who's not. So a week ago, I would have not been able to sit and do this. Today, I've, through some help with my doctor, I'm able to sit and actually discuss this. And I hope that it sheds some light on what's really going on for people. And if it only helps one person, then it was worth sharing my story. So.
Thank you. Thank you so much.
Thank you, Maria. And just a final reminder to journalists on the line to use the raise hand button if you would like to ask a question. And I'll just give you a couple of moments. We have no further questions on the line, so I will hand it back to Monique Taylor.
Thank you so much. And thank you, Tammy and Josie, for taking the time to come and share your stories today. It's so impactful to allow people to hear how workers were feeling while we were at home safe, and you were out there doing all of that heavy lifting, and there are side effects from that, and the government needs to recognize that, and they need to put measures in place that prevent from the long-term effects. Right? We know that that the fourth pandemic coming, or the fourth wave of this pandemic, is going to be mental health. And we need to ensure that people have access, that workers have access to real services, and that the WSIB doesn't have the ability to fight back against those workers. That's why the presumptive was such an important piece, because while I want you to get services and I want you to get it from WSIB, I don't want you to have further trauma from fighting WSIB just to get what you need. So thank you so much for joining us all today. Thank you, Maria, for joining us from The Spectator. I truly appreciate your time. This bill will be debated on April the 12th, and I sincerely hope that the government members will vote in favor of this and really show what heroes you truly are, and know that you deserve to be taken care of as you took care of us. So thank you so very much.
Thank you.
Thank you.